Hi everyone, I'm Dr. Loren Carver. I'm a pelvic floor physical therapist, and today we're going to focus on different ways to relieve pelvic floor pain from the muscles or maybe from a nerve irritating you. The pelvic floor itself is very weight bearing, so it takes a lot of the upper body, and the pelvic floor muscles are supporting us throughout the day. So sometimes it feels really nice to get in positions where our pelvic floor is weightless. That can really help with symptoms, especially pain symptoms. So I'm going to go through a flow today, and we're going to talk about how your breath matters. I want you to think that the pelvic floor and the diaphragm are intimately connected. When you take a good deep inhale, your pelvic floor should actually expand and release and relax a little bit. It lengthens. When you exhale, it kind of recoils back into its resting position. So we're going to practice breathing with different movements today. So the first thing we're going to do is we're going to take a yoga block or something similar that we can really put underneath our hips to kind of get our body in a position where our hips are above our head. That's going to feel very good on our pelvic floor. It's going to take a lot of that weight away from it. So what we're going to do is you're going to go ahead and put your block down here. You're going to slide yourself over towards the block. And I want you to really take a couple of good deep breaths in this position first. So think about your abdomen expanding. Think about your pelvic floor expanding. Almost like you're trying to draw some of that air all the way down into your pelvic floor, almost like you're breathing towards your holes. Then you're going to take your block here, and this is going to get rested underneath your pelvis. So you're going to lift your pelvis up, and then the block is going to give you some support. Now, if the block is too high, it's probably going to be uncomfortable. So you want the block nice and low so that you can really just like let your pelvis settle into that block. And then take a couple deep breaths here. You might need to kind of let your arms hang a little bit. Think about palms maybe being up, neck being relaxed. Pelvis feeling really heavy on that block. You can kind of wiggle around a little bit so you can feel that. I'm going to take a couple nice good deep breaths, and I want you to think about gently inhaling all the way down into your pelvic floor. As you inhale, you should feel the air move all the way down into your pelvis. On the exhale, we're not contracting anything, we're just kind of letting the air fall out of us. So again. Good. Next, we're going to go ahead and bring our legs up into an upright position here. And we're just going to let our legs kind of hang like this. It shouldn't really feel like effort to hold your legs up here. They should stay nice and relaxed. And I want you to take a couple deep breaths here. You might be able to feel your pelvic floor expand a little bit more on that inhale. Really think about drawing the air all the way down into your holes. Good. Next, you can kind of kick one of your legs up a little bit. You can wriggle your ankle, roll it around a little bit. It shouldn't feel like a ton of effort to hold that leg up. If it does, you can kind of gently grab behind that leg just to give yourself a little bit of extra support as you wiggle. And then you can try the other one. Really paying attention to keeping your pelvic floor nice and relaxed. Inhaling. Exhaling, letting the air fall out. You can do a little small circles here with your hips if that feels good. Now the inner thigh and the pelvic floor have really close connections to each other. So Being able to stretch out the inner thighs can really help to open the pelvic floor, decrease tension. So from here, if it feels okay, you're gonna take one leg out and you're gonna grab that inner ankle. And then you're gonna take your other leg out on the other side, grabbing that inner ankle. You should feel a nice, good stretch in your inner thighs. If that feels like it's too much, you can take your arms on the outside or to give yourself a little bit of extra support here so they're not flopping out quite as far. If it feels good to you, you can actually just let your legs hang and you can just relax your arms all the way down. And this should feel like a nice stretch, kind of almost above your sit bones, in your inner thigh and in your pelvic floor. And then keep breathing, deep inhales. You can kind of sigh as you exhale. Good. I'm gonna give your legs a little bit of support on the way back in here. Again, a little hip circle action. You kind of sit one leg up here. And it feels good for you to do so. You're going to kind of let your leg drop out to the side into almost like a V position. If that hurts or it feels like too much, you're just going to bend your knee again, and let's do this position. But if it feels okay for you to do this, you're gonna take a couple good deep inhales, and then on the other side. If you want, you can use a wall to kind of give you some support. Feels good to you, you can do both sides. Good. From here, we're going to extend one leg down, stretching out the front of the abdomen and the hip. Taking some nice, good inhales. You should feel a stretch through this area. And then we're going to switch sides. Gently bring that leg up, and then same thing over here. If you decide you want to give it a little bit of an extra stretch, you can kind of pull this hip into flexion. Try to keep that heel of that bottom foot on the ground as you breathe. If it feels okay for you to do so, you're also going to reach overhead and then give yourself a little gentle side stretch. Opening up the front of this thigh and the side of your body. Placing that leg down, we're going to go for the other side. So pulling this leg up into a good position, feeling that stretch there. Reaching up with this arm, grabbing it with your other arm, then gently setting yourself off to the side a little bit. Nice, good deep breaths. Good. And then you can kind of come back in and then bring that other leg back up. And really think about taking all the weight off of your pelvis. This is allowing your pelvic organs and your abdominal contents, your GI system, to come away from your pelvic floor. So your pelvic floor no longer has to hold them up. Really good if you have prolapse symptoms or any type of pelvic pain or tension. Feels really good to do this. So we're gonna come off of it. So I'm gonna lift one leg down and then the other, and then I'm gonna lift my hips up to take the block away for a second. From here, we're gonna gently roll over onto our stomach. So from here, we can take a couple of different props. You can use a Pilates ball, or you can also use a tennis ball to help you. We're gonna put this Pilates ball at our abdomen. You wanna think kind of like in the crease here. And we're gonna take this leg off to the side a little bit. So with the Pilates ball under you, you're gonna take some good deep breaths. You're gonna inhale. As you inhale, you're inhaling into the ball. And then on the exhale, you're gonna completely relax as much as you can, letting your ball kind of just draw into your belly. If you're okay with a little bit more intensity here, you can kind of take your other leg down. Good. You're going to try the other side, so you'll take that ball into that other hip, and then you'll lay down. Good deep breaths. If it feels like it's too much, you can take that leg and kind of place your leg up a little bit. Same thing, good breaths. Remember, our abdomen and our pelvic floor are intimately connected. When our pelvic floor, our abdomen is tight, usually the other one follows. You can kind of prop up on your elbows a little bit. We're gonna take that ball and we're just gonna gently roll it, kind of up and down that abdomen, all the way from that pubic bone to the inner hip crease. This area. Side to side. Focusing on the areas that may feel a little bit more tender to you. Good. And take that ball away. We're going to do a couple of supported stretches at the wall. So one of the first stretches we're going to do is hamstrings up the wall. And so you're going to get close to the wall and you can kind of shimmy your legs up it like this. So we're going to start with hamstrings. If it feels good to you and you really liked that supported position, you could put a block underneath your hips again here. Deep breaths all the way in to your pelvic floor. Imagine softening that area. Next, we're gonna take a V stretch at the wall. So really nice to kind of give some good support to those muscles. And as you're here, you're gonna take some deep breaths. This could be pretty intense. So if it's too intense, you can kind of walk your legs back up the wall so that it's not as intense. I'm gonna work a little bit deeper here. I feel a good opening in my pelvic floor muscles. Couple deep breaths. I'm going to give myself a little support here since I am kind of deep. This allows my pelvic floor and my legs to relax more. If I just had them in a really aggressive stretch, they're going to have a hard time relaxing. So I'm just going to give them a little extra support here. Good. Now we're going to move away from the wall just a little bit. Not much, but just a little bit. We're gonna go back up onto the wall and we're gonna do a modified happy baby stretch. So using the wall, you're going to pull one leg up and you can go pretty wide with it if that feels okay. There's different grips. You can pick on the inside, which I like. You can pick on the outside, which is also nice. You can also kind of grab your ankle here for a deep, happy baby stretch. And then gonna go ahead and switch sides here. So I'm taking the other leg into that deep, happy baby stretch. Good deep breaths. and then come on back up. So that should be a nice flow that you can use if you are having pelvic pain. Really pay attention, pelvic pain or pressure, really pay attention if you are having symptoms around a certain activity. If it's more at the end of the day, you're having symptoms, and so you can use some of these movements throughout the day in order to help you with some of that pressure and discomfort that you're feeling. I hope this helps. If you are new to my channel, make sure you subscribe and hit the like button. That really helps other people find this content who really need it. Helps give them some hope. So thanks so much for watching. We'll see you next time.